Hi everyone, this week I'd like to draw the short axis, the parasternal short axis at the level of the aortic valve, and we'll label our structures. So here's our aortic valve, and I'll always pop in my upside down Mercedes-Benz symbol, and I'll label that non, right and left, and we'll talk more about that in a moment. I'm going to draw here a little portion of the main pulmonary artery, but then I really like to focus on the left atrium. So there are a couple of different views here. There's obviously a view where we get to see the main pulmonary artery, and there's a view where the left atrial appendage is more dominant. And so that's the view I really want to look at here. And I'm drawing the back of the left atrium. I'm going to draw the interatrial septum, and I always imagine that interatrial septum is an arrow pointing straight at the non-coronary cusp. I'm then going to draw in an IVC a little bit here because I think we often see it in our image, so I will just label our IVC there. And then coming up to the tricuspid valve, and then I finish the circle by drawing the right ventricular outflow tract. And I think you'll see I've made that a little bit big, so that looks a little bit dilated in this patient. I'll draw in the pulmonary valve leaflets. Okay, so let's have a look at labeling of this structure. This is a short axis of our parasternal long, and we mentioned our parasternal long, we have our RV here. Well, this would then be called RV outflow tract because the blood's leaving. This is our left atrium, and obviously the aortic valve is in the center of the heart. So let's focus on this left atrium a little bit. I have drawn in here the left atrial appendage, and here we have 3 of our 4 pulmonary veins. Now, the pulmonary vein parallel to the left atrial appendage is the left upper pulmonary vein. Coming in at very close proximity, so the lefts and the rights, they come in very close to each other, is the left lower pulmonary vein. So left upper, can you imagine what colour Doppler would show you there? Sometimes no colour, sometimes a little bit of a downward, maybe blue colour. But what about left lower? Well, left lower is coming straight up, so that's often going to be a red, and I say flick of the wrist and you can see that flow. Over here, we have our right lower pulmonary vein, which will again be a red. And our right upper comes in at an angle that I have a really hard time and very, very challenging to find that, but I challenge you to do that. But of course, it will be coming downwards, so expect some sort of blue colour Doppler signal. We then have our left atrium, so this is our interatrial septum, as we said, pointing towards the non-coronary cusp, and this is our right atrium. This IVC flow, just remembering IVC flow hits the atrial septum because during fetal life, that actually flowed into the left atrium. So IVC hits the atrial septum and then flows up to the tricuspid valve. And I always try to remember that. IVC is directed towards the atrial septum, whereas SVC goes straight towards the tricuspid valve. So here's our tricuspid valve here, and then here's our pulmonary valve here. So I'd like to just talk a moment about what are the cusps of the tricuspid valve. What are we looking at here? And I think it's really important to remember, well, the pulmonary valve is the most anterior valve. This is out in front, so this is anterior here. The aortic valve is in the middle, and the tricuspid valve is at the back of the heart, so this is posterior. And I think that makes it really easy to realize that this here is the posterior tricuspid valve leaflet. And this leaflet here, well, I call it the 50-50 rule, okay? 50-50, because 50% of the time it's the anterior tricuspid valve leaflet, and 50% of the time it's the septal tricuspid valve leaflet. But the posterior is a nice and easy one to remember. Hope that helps. See you next week.